project was on metabolic syndrome. Metabolic syndrome is a group of conditions that increases the risk of diseases such as heart disease, diabetes, and stroke. These conditions include having high blood pressure, high blood sugar levels, high blood triglycerides, low HDL cholesterol levels, and having abdominal obesity. About 1 in 3 Americans have metabolic syndrome, and it can be prevented. Some symptoms of metabolic syndrome include having a high blood pressure reading of 130/85, a blood pressure reading of 100 or higher, high triglycerol levels of 150 or higher, low HDL cholesterol, which would be less than 40 for men and less than 50 for women. Some other symptoms of metabolic syndrome can include darkened skin in the armpits and back of neck, having blurred vision or increased thirst and urination, as well as tiredness and weakness. Some lifestyle factors that can increase your risk for metabolic syndrome include being inactive, eating an unhealthy diet, not getting enough quality sleep, smoking, and overconsuming alcohol. Some uncontrollable risk factors include age, environment, genetics, sex, and having other conditions, which include PCOS, psoriasis, sleep apnea, or other sleep disorders. And some treatments or medications can also increase your risk for metabolic syndrome, such as cancer treatment and medications for allergies, depression, HIV, bipolar disorder, and schizophrenia.
Hi, I'm April. And so for my part in the project, I'm covering the pathology of metabolic syndrome. And so what I found was that there's no actual cause, like in terms of metabolic process, and that's because there's just a cluster of so many things. And so that's kind of what experts are having issues with is navigating which one is actually causing all of this to happen. And so with that in mind, the experts realize that insulin resistance is common in patients with metabolic syndrome. And what we're mainly looking at in that is lipolysis. The function of lipolysis is impaired, and that leads to excess fatty free acids. And so when there's too much fatty free acids in the body, insulin resistance worsens. And then that kind of starts going down into a cycle and affects other parts of the body, more notably in the muscles and in the liver. So in the muscles, we're going to see a decrease in glycogen synthesis, as well as glucose transport. In the liver, it's mostly going to be gluconeogenesis and lipogenesis, but the exact mechanism in that area still needs to be researched. And so essentially, when all of those are combined, we end up with hyperinsulinemia, essentially high amounts of insulin in the blood. And that's usually because of insulin resistance. Another part that we're going to be looking at is adipose tissue, and that's because it contributes to the pro-inflammatory and pro-thrombotic state. Uh, so leptin specifically, when there's a high amount of leptin in the body and that high amount is not able to fix any metabolic disturbances, which is most commonly seen in obesity, we see that there is a resistance to leptin in the body, and essentially the tissues are no longer responding to leptin, uh, and that just ultimately, again, that promotes the pro-inflammatory immune response. Also, increased leptin is related to increased risk of cardiovascular disease and inflammation. And a cytokine that we're going to also look at is interleukin 6, and that's released in response to hypoxia, which is a lack of oxygen to the tissues, I believe. Essentially, what's going to happen is an increase in fibrinogen levels, uh, and also an increase in inflammation, dysfunction, as well as atherosclerosis. It also is a product that would involve for C-reactive proteins, and it's basically CRPs are related to cardiac events and metabolic syndrome, as well as type 2 diabetes. And other possibilities of pathology for metabolic syndrome would include sleep disorders, chronic stress, mitochondrial dysfunction, and the thrifty and programming hypothesis. And that's essentially just saying uh, for poor nutrition in early life as well as during fetus development, that individual will essentially be more prone to having metabolic syndrome. For fetus development, uh, the musculoskeletal, endocrine, and cardiovascular systems form last, and so that's kind of why we're looking at that more specifically in that hypothesis. We're also going to look at the poor nutrition intake that they have earlier in life, and again, that's part of uh, that being increasing a risk of metabolic syndrome is lifestyle, genetics, um, do factors around you. And so that's kind of essentially what we're looking at. Thank you.
Hi guys, my name is Patricia and today I will talk about the dietary recommendations for metabolic syndrome. So first of all, we want to encourage to follow Mediterranean and DASH diets. DASH diets is a dietary approach to stop hypertension. This diet focuses on reducing sodium intake and consumption of potassium-rich foods such as bananas, dates, spinach, salmon, green leafy vegetables. And we want to do that because we want to manage blood pressure better, and this is a key component for the metabolic syndrome. Second of all, we want to focus on the quality of carbohydrates. We want to emphasize the complex carbohydrates with a low glycemic index over the simple sugars, which can improve insulin sensitivity. Basically, reducing the intake of high glycemic index food and beverages, especially those with added sugar, is crucial. We can avoid the high blood and glucose spikes, and which can contribute to insulin resistance. First of all, we want to encourage to eat fats. So unsaturated fats, we will focus on olive oil, nuts, almonds, and fish. It's a priority for us. We want to limit the trans-and-saturated fats, which comes from transformed foods, such as ready-to-eat food overall and fast foods. And lastly, fiber is really necessary in these conditions. We want to encourage high fiber intake. It is linked to better body weight management, blood pressure, blood sugar, and cholesterol level, and fiber-rich foods such as fruits, vegetables, whole grains, legumes, nuts, and seeds. And I don't have that in my presentation, but we want to encourage for regular physical activity, which can improve weight loss and improve insulin sensitivity, and offering approach to managing metabolic syndrome as well. Thank you.
Hi guys, my name is Kylie and I'm going to be going over the complementary / alternative treatment options someone can use if they have metabolic syndrome. Before we get started, I'd like to note that yoga is also included in this list. I didn't have enough space to put on the slide, but yoga is a low impact mind-body stress relieving exercise one can use to help relieve oxidative stress and alleviate metabolic syndrome induced disorders. So let's get started with cinnamon supplementation. Cinnamon was shown to activate insulin receptors on the cell membrane, and it also decreases tyrosine phosphatase. which is an enzyme that blocks insulin activity. In this study, it was shown that there was an increase in glucose uptake, there was an activation in glycogen synthase, and it also helped prevent insulin resistance, in turn increasing insulin sensitivity. The second option someone can use is nutraceuticals. There was a systematic review that looked into green tea, pomegranate juice, garlic, as well as ginseng to see what effects it has on the body. Green tea was shown to significantly reduce total cholesterol, that includes LDL-C. Pomegranate juice and garlic was shown to reduce blood pressure. I probably should have noted beforehand that what nutraceuticals are is just an isolated nutrient that helps provide health benefits and basic nutritional value overall. In this study, ginseng was found to reduce fasting blood glucose, improve HbA1c, and body weight in diabetic patients. It's also interesting to note that it helps with lipid metabolism. So on to our third option, we have herbal medicines. A systematic review looked through East Asian medicine theories, which included traditional Chinese medicine, traditional Korean medicine, and Japanese Kampo medicines. It also included Western medicines and acupuncture as well. So it was a total of 12 randomized controlled trials, and they all found that there was a therapeutical effect on regulating waist circumference, as well as blood glucose, blood lipids, and blood pressure. So these are just a few options that someone can look through. It's also important to note that you would want to talk with a professional about each of these and just let your provider know that you want to.
For our first recipe, we chose a soup. We chose creamy almond squash soup, and it is relevant to metabolic syndrome from the ingredients olive oil, which helps lower inflammation, butternut squash, which is rich in fiber and vitamins that support weight and blood sugar control, almonds, which contain healthy fats and magnesium to help improve insulin sensitivity, a low sodium broth to help manage blood sugar, lemon juice, which has antioxidants that support metabolism. Our next lunch recipe is a berry chicken salad, and for metabolic syndrome, it is relevant from the berries, which have antioxidants that help control blood sugar and reduce inflammation. Canola oil and almonds have healthy fats that support heart health. Spinach and lettuce have fiber to improve digestion and blood sugar stability. Then we have some lean chicken breast as the protein, and some feta cheese that has calcium and a little bit of protein as well for overall metabolic support. For our dinner recipe, we chose Mediterranean chickpea skillet, and it is relevant to metabolic syndrome from the olive oil, which has monounsaturated fats and polyphenols. Chickpeas that have fiber and protein to stabilize blood sugar and satiety. Some kale that provides nutrients and antioxidants for lipid metabolism specifically, and it also reduces inflammation. Some feta cheese again, and then a whole wheat pita bread with fiber that helps with blood sugar control and digestion. For our breakfast recipe, we chose apple, pecan, and maple baked oatmeal. The ingredients that make it relevant for metabolic syndrome are whole rolled oats that have fiber and beta glucan, which show some correlation in lowering cholesterol and regulating blood sugar. Pecans that provide healthy fats and antioxidants that help with inflammation and metabolic health. The apples that provide fiber and antioxidants, which can aid in blood sugar control. Maple syrup, which is lower on the glycemic index and won't spike your blood sugar as intensely. Milk and eggs provide protein and calcium. And then the cinnamon will help regulate blood sugar levels and is anti-inflammatory. For our dessert recipe, we chose chickpea brownies. And for metabolic syndrome, it has chickpeas again, nut butter, which will provide healthy fats, maple syrup again, and then some coconut oil, which can boost good cholesterol, almond flour, which is also lower on the glycemic index, so it might help with some weight control and insulin spikes. Cocoa powder, which is good for reducing inflammation and improving blood flow, and some dark chocolate chips, which can have a little bit of aid with insulin sensitivity.